welcome to Manhattan Dermatology. How are you?
I'm good. I'm here to see Dr. Amin.
Perfect. Have a seat. He'll be with you shortly.
Hi, my name is Dr. Amin. I'm a dermatologist in Midtown Manhattan at MDCS Dermatology. I've been in practice here for about 14 years. I graduated from Weill Cornell residency program in dermatology, and I also did a fellowship in Mohs surgery. I'm in practice with several other doctors who are also board certified dermatologists.
So it's Melanoma Awareness Month. Can you tell us a little about skin cancer?
There's three main types of skin cancer: basal, squamous, and melanoma. Melanoma is the best known skin cancer because it's also one of the most deadly forms of skin cancers.
So what are the risk factors for melanoma?
The risk factors for melanoma fall into two categories: family history and ultraviolet light exposure.
So what can we do to reduce our risk of melanoma?
The most important step you can take to reduce your risk of melanoma is to get your skin checked by a board-certified dermatologist. You can also prevent further risk of melanoma by reducing ultraviolet light exposure.
How can I reduce my exposure to ultraviolet light?
There's three parts to that question. One, you can avoid the sun at peak sunlight hours. Two, you can wear clothing and hats to prevent ultraviolet light exposure. And three, you can use sunscreens.
So what are your recommendations for sunscreens?
It's important to have a sunscreen that blocks both UVA and UVB light. I often recommend sunscreens that contain zinc and titanium oxide as its base ingredient.
Are there any sunscreens I shouldn't use?
That's an interesting question. Hawaii just banned oxybenzone and octinoxate, which are chemical sunscreens that can damage the coral.
Do we have any alternatives for sunscreen?
Yes, an alternative to sunscreen is using rash guards, clothing, hats, and a roof.
What's your advice for home skin cancer screening?
Although many patients find their own skin cancers, I think it's common sense to start with a dermatologist skin check in the office and then look at your skin once a month at home and note any changes.
So I noticed Mohs surgery on your white coat. Can you tell us a little bit about it?
Sure. Mohs surgery is a type of skin cancer surgery for melanoma, basal cell, and squamous cell carcinoma that involves producing the smallest possible scar and the highest cure rate.
So before we leave, what's the most important tip you have for your patients?
As a skin cancer surgeon, I strongly recommend that everyone get an annual skin cancer screening in the office with a board-certified dermatologist.